Hello, this is Annalie Martin, and today I'm going to be talking about positioning and mobility devices and assistive devices. So with assistive devices, I'm going to start with talking about walkers and canes. So they must be positioned at the correct height for the patient, and they also would want to do like the slight bend at the waist, and it would want to be at the height of their hip bones. If the walker is too high, they may fall backwards, so that would be very unsafe for the patient. Using a walker, one mnemonic that I found helpful is LAWS, which is lift, advance no more than 6 to 12 inches ahead, and W, their weak leg, and then S, the strong leg. You can always so that you always go on the strong side, and that allows the weight on the strong side on the strong arm to move the bad side. So with the quad cane, you are going to have less support than the walker. It's going to be more like on the feet on the side of the body, and it's not recommended for use on stairs, and you're going to want to make sure that they're wearing grip tight shoes. And my professor did go over this a little bit with us in person. She said that for most of the time there will be help with this. There's usually the physical therapy will come, so that's good to know. But of course, you're going to want to know that as the nurse anyway, so that you can assist the patient in the best way possible. And now I'm going to be talking about positioning and mobility devices. There's continuous passive motion, where it helps slowly and gently bend and straighten a joint after surgery. You may keep the body part in constant range of motion, like the low speed. If they just had knee surgery, it really just depends on what the doctor ordered. You want to lessen pain, stiffness, swelling, and scarring, and you want to improve blood flow, and you also want to promote cartilage growth, and you want to decrease any chance that there may be an injury. You also want to, and sometimes an order may be given for the passive range of motion, which that you would also go by that, and sometimes you will have help of the physical therapist. So you may so with the pillows, we did do this in class. We learned about the abductor pillow, or the abduction pillow. It's a triangular pillow with leg straps that is placed between the legs while supine to maintain proper hip alignment. It's usually used with hip replacements, and it keeps the legs abducted. It's not considered a restraint or anything, but it makes it easier also if you need to turn the patient. We actually got to use one in class. That can only be delegated to an LPN. So you are going to want to check for skin breakdown, check for blood flow always, the cap refill, pulses. There's also a trochanter roll, which prevents the hips and legs from rolling outward. This is usually from the hips to just about above the knee. You could either do it with a blanket, or they actually make them. We were able to see them in class. The client places their thighs in a neutral position, and it's used supine. It's used for hip dislocation, muscle weakness, paralysis, and it keeps the legs and hips properly aligned when the body is unable to support without further surgery. And that also can only be delegated to an LPN. So I hope I covered everything for week 4. If I missed anything, or you need any clarification with anything, I'd be happy to add that in. So thank you very much for watching.